Welcome to my podcast. Today I'm going to add a few points like top up for treating unconscious patients. So it's basically that you are in the emergency A&E and you suspected a patient who seems to be in sepsis or septic shock, which basically an infection with evidence of organ dysfunction, and that's something that you don't want your patient to reach to. And this means basically that there is a change in the baseline of the total of the SOFA, which is characterized by 6 distinctive scores, which is sequential organ failure, and mostly includes scoring for the respiratory cardiovascular system, also for the coagulation, renal, and neurology. So basically, you have to score, and if it's a total score of 2 points, or the news to score of 7 means there's an element of organ dysfunction. So you have to assess your patient and start the measure immediately accordingly to the situation. So the patient, if the patient is in septic shock, for instance, and means basically by this there is persistent hypotension, which is requiring to introduce vasopressor in order to maintain the arterial pressure, which is recommended to be more than 65 millimeter mercury, and the serum lactate should be more than or equal to 2 millimole despite the adequate resuscitation. So that's basically what septic shocks means. And you start to give a fluid, of course, preferably crystalloid rather than the colloid. And I mean by that mostly it's Hartmann's solution, which is the treatment of choice as a measure for the initial resuscitation and for the intravascular replacement. And dose recommended is 30 milliliter per kg in the first 3 hours of the resuscitation. And it's been stated any delay in starting the empirical antibiotic will be associated with increased rate of death in hospital death with an odd ratio of 1.04. The other thing that you need to start is the noradrenaline, and should be started early when the fluid alone fail to maintain adequate perfusion. And of course, we don't want that to happen because this will lead to multiple organ dysfunction and failure later on if measures has not been started to correct the hypotension and the sepsis around this area. Those just few points I read recently, and I thought to top up adding to the following case that I did recently. Thank you.